Hello everyone, welcome to Adult Literacy Lincoln. I'm Samaya Khan and today I'm here at the optometry office of Dr. Elizabeth Gurkey. So I had actually visited the Pearl Vision the other day because I needed an eye exam and I thought I should share my experience with you.
Hi, my name is Dr. Elizabeth Gurkey. I'm an optometrist, which means an eye doctor here at Pearl Vision. I graduated 18 years ago. I did. Ever since I was in high school and I got my first pair of glasses, my goal was to become an optometrist. I love it. It's a great profession in the fact that most of the time it's really positive. I don't typically have to break bad news. No, typically not. Occasionally, I'll ask patients to come in after hours if I need to follow them for an eye infection, but most of the time, no. I've been here 6 years now. It's a great place to work in the fact that I get a lot of control over how fast I see patients or slow. So we typically will book each patient 30 minutes, so I have plenty of time for adequate patient care. The first stop is the exam room. This is where we actually do the eye exam. Patients typically will be in this chair the entire time. We use the eye chart on the wall to see how well or how poorly they can see. You can tell it gets much smaller on the chart, which for patients is good news. That means they see well, versus some people like myself without glasses can't see that. It's a magnification with a light, so we get a really in-depth look at a patient's eyes and the health of their eyes. This is called a phoropter. This is what we actually check a patient's prescription with. This is a transilluminator. With this, we check eye muscle movements and pupil reflexes. This is what we call a retinoscope. With this, we start to get an idea of a patient's prescription. This is basically a 3D test. We use it to check and make sure both patients are using both eyes equally. And this is the color vision test. There's various colors, and we'll check to make sure patients are not colorblind. Welcome to the lab. This is where we actually make glasses. There's various lenses, the material, the coating, all of it is stocked in these drawers. From there, the lenses are brought over here where they're marked up, and the edger cuts them down to fit the frame. They used to be made of actual glass, but the glass was very heavy and hard to make. Now they're made of plastic, which is actually much safer for patients. We probably process close to 100 pairs a week. This is the tint machine. This is where someone, if they want sunglasses, we actually tint their lenses. So instead of a lens being clear, we can make various colors where they are either brown, gray, some people like pink, but we can dye them any color. Most people come in because they need glasses or they just want to check up. Either way, insurance companies will cover typically a routine eye exam once a year. We accept almost every plan. We accept WellCare, Total Care, Medicare, iMed, VSP. There's a variety of insurances, even in those groups, but we typically accept insurance in almost every companies. Yes, we do. Most insurance companies will cover an annual eye exam and glasses if needed. The doctor's offices will show you what frames qualify for your insurance. Not every insurance plan will cover every frame, so they'll make sure that you know what is covered by your insurance. You can call the office or you can schedule online. If you call the office, the receptionist will answer, ask when you would like to come in, and see if there's an appointment available at that time. You are required to wear a face mask at all times in the office. We've also changed our paperwork. You will not fill out paperwork, so there's fewer things to touch. We also sanitize every frame once it's touched. Every surface will be sanitized after each patient. Thank you for coming into Pearl Vision and visiting my office.